Is everybody ready?
Yes.
Good evening. It's 6:30 PM and I'm going to call the Board of Health meeting to order. First item, if everyone could please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. Hi. That'll be too low. All right, first item up on the agenda is to accept the minutes of September 21st, 2016 meeting.
Make a motion to accept the minutes?
I second that.
I have a motion and a second. Any discussion? Hearing none, all in favor?
Aye.
Aye. All right, unanimously it passes. Number 2, inspection of nail salons. Okay, so we all have received the updated information with the dates correct and everything. Did everybody read through it?
Mm-hmm.
Okay. So what we're looking for is to approve this. And
I've read through it and the dates are all updated and that's all we asked for, so.
Right,
Yeah,
right.
and the changes were made, so.
Right. So if everybody's good with that, I will entertain a motion. I entertain a motion.
Yes.
Yeah.
What's our motion? Our motion is to
Accept?
accept the guidelines for the implementation and enforcement of Dudley Board of Health nail salon regulations.
Yes.
And,
And I second that. What else?
We have,
second part,
this is our, this, and this too. This.
the Dudley Board of Health nail salon regulation,
I don't have that.
and
Application and checklist. What's that one?
the application checklist, and
Public health notice,
The
which
public
needs to
health
be
notice.
displayed.
which has to be displayed in each
Aha.
Salon.
salon. So is that one motion with 4 parts?
Mm-hmm.
All right, so
So you've made that motion?
I've made that motion.
Do you see
Oh,
other
se-
one?
Yeah, no, I just didn't see the yellow one, but that's fine.
Okay.
Yep. Good. Second that.
Okay, so I have a motion and a second. Any discussion? Seeing none, we'll take a vote. All in favor?
Aye.
Aye. So it passes unanimously. This will go into effect January 1st. And we have the official copies here that we have to each sign and initial. So I'm going to take a moment to do that. Initial. Initial.
I have the board's permission to submit to Lori a copy of each.
Yes. Teresa,
How many copies are we, oh, this is the same.
this is the, yeah.
Different one, okay.
And I would ask that now, since these are approved, if you could upload them to the website so that they'll be on the website for everyone to view. And they can directly print them right from there, view anything that they need. Most
They'll
definitely.
be available by Monday.
By Monday, excellent. Thank you so much. I'm just gonna pass that on. Okay. All right. Next up on the agenda, we have an order to appear for Yummy Chinese. If you want to come up to the microphone. So, let me just go over a little bit of information. So on 10/5, an inspection was done by our health inspector, and there were quite a few critical violations. we then, as the Board of Health, were notified by text message and email that there was some issues going on. So what we did is contacted our health agent, and he asked us to come and see the information directly. So we went out there on that Saturday, which was the 8th. Myself and Mr. Zakowski went out and also found numerous critical violations. So at this time, we're here to discuss those and go forward from there, see what we come to. Do you have anything you want to add before we start?
No.
Anything? Okay. So, and just to back up a little bit, we have the whole file here ongoing, and some of these violations were back in 2012 noted as violations as well. And it's not just because of this one inspection. These have been ongoing violations over a course of several years that we've been trying to work to get these rectified. And now it's just come to a head, unfortunately. So we're here because our job is to protect the public as well as help you be the best that you can be. So we'll start. So I'll let you, if you have anything you want to say, and then we'll.
Yeah, I mean, I'm sorry, for all the troubles, we make, But, for so many years, we've been in Webster and Dudley for almost 15 years.
Mm-hmm.
I've been working with Tom Purcell, he's my, health inspector. I try to cooperate with him, to resolve all the stuff. But this time, definitely there's something wrong with there. But for so many years, I just want to state, something. I'm not excuse. I just try to, give a little, issues about Yummy. From my knowledge, for very serious violations, that means get people sick. So first, I don't think if in 15 years, any customer called Yummy, and they said because they're eating the food there, they get sick. Yeah, I don't think they call the Board of Health too. If they called, you guys could calm down. Second thing, every time when the inspector coming, they never find anything turning bad, just like chicken, something, turning bad, right? The third, all the equipment in there, the cooler, walking, cooler, freezer, refrigerator, they're all, working fine. So, I mean, I know we still have a lot of problems, we try to resolve, but for the major stuff, I think, we still doing okay. And I forced the employee there to get serve safe. I can show you right now, Yummy, we got a 4 serve safe certificate. I still try to arrange another 2 people to get it, This the thing. Another thing I heard, because I was not there, I heard about the walk-in cooler, right? We're starting to do that project, a couple years ago. It's not because, actually I discussed with Tom. It's not because he forced me to do it, because I want to get a kitchen bigger, and I think that one, we should move on. I talked to the contractor, actually I paid him money already, a couple years ago. I got his plan here, and his receipt for the money, all the stuff, But for this one, I will do it pretty soon, because I hate that kitchen. Tell you guys the truth. Yeah. So about I need a very professional like architecture designer to do the blueprint, and I will present to you guys to get approved. This time, not only I want to do the walk-in cooler move outside, I will change the tile there, I will rearrange the walking, like, you know, the section, all the stuff, yeah, because I'm planning, I just, you know, see, you guys, you know, give me the, you know, a little time, you know, I will get that blueprint, you know, probably just a couple weeks for you guys, yeah. I contacted a couple contractors, some Chinese, you know, building companies, yeah.
Okay. Let me just, I'm going to respond to a couple of things that
Yeah.
you said. About critical violations, a critical violation does not mean that someone got sick from it.
Yeah.
I'm going to let, Julie is our covering health inspector right now, so if you could just explain what a critical violation is,
It
please.
could be related to a foodborne illness, and that's what we need to avoid.
Yeah.
So that's what, you know, critical violations are.
Yeah.
I was wondering, you had mentioned that you have additional staff that has recently taken ServSafe, is that what you said?
Yeah.
How many people, and where do they work in your restaurant?
What's that?
Where do they work in the kitchen?
Yeah. We have right now, including me, is 5 people working there.
Right, but
And then we
who
got
has the
3.
how many people have the certification?
3 and my wife. Yeah.
Okay.
So the whole restaurant got 4.
And this is all recent?
No. Me and my wife got that since beginning. You know, yeah. In Webster, we got it every 5 years. You know, we got to, you know, redo it. Yeah. So this by law, you need it. You know, yeah.
Right, I mean, that's why,
Yeah,
you know,
yeah,
the
yeah.
person in charge, there should
Those
always.
2 is,
Right, but there should always be a person in charge that is ServSafe certified.
Yeah.
And the last one that we have here, that is yours, has expired. So we would need, the one that we have expired in July.
oh, that's mine. Yeah,
Yeah.
I got a new one. You know, yeah. I got a new one with those 2 guys.
And his wife's
Yeah, yeah, yeah.
expired in 2015.
Then-
I think they changed it already a long time ago.
Did I see that you have copies of your current ServSafe
Oh,
certificates there?
mine I didn't bring, but I can get to you tomorrow. Yeah. It's,
Because the ones we have here
They're
are
both
all expired.
yeah. It's, you can write you can ask someone right now take a picture over there. Yeah, it's definitely not expired. Yeah. I, yeah.
So then, the other question I have is for the allergen awareness training,
Yeah.
that also has expired as well.
Yeah.
Do you have recent certification? Do you have new certification for your allergen
Oh,
training?
this one I don't. Yeah, this one I don't. Yeah.
As, what about anti-choke?
Oh yeah, that one I had. Yeah.
Okay, because the one that we have here also has expired.
Yeah.
So the updated certifications need to be submitted to
Okay.
the Board
sure,
of Health
yeah,
office.
Okay, I can get that. Yeah.
One of the concerns that if I could address him
Certainly.
regarding this, one of the concerns that I have, knowing that you have, you and your staff have recently taken the ServSafe certification, it's concerning, whenabouts did you take the ServSafe certification?
When?
Yeah,
You know, after you and the Tom.
So
come
after
down,
July?
Yeah.
okay,
Oh,
and
not July, right? Yeah, I think it's September. right?
September?
Yeah, September. Yeah.
So, my concern is, in October,
Yeah.
some of the issues or some of the violations that were found,
October.
especially the improper thawing
October. Oh, you mean October, right?
of this year.
Yeah.
So I'm just wondering if,
Yeah.
maybe, you might need to have a better understanding
Mhm.
of, you know, some of, actually, the course itself, the ServSafe certification, you're improperly thawing, food, which is a serious, could be potentially a serious issue. Some of these, the violations that have been listed, you should, the person in charge should know that this isn't
This what-
acceptable practice.
This was another issue, you know, what I want to talk, you know, yeah. From now on, I will be in the kitchen in charge everything. And then I just try to arrange other guy, you know, this guy, you know, they got a, you know, ServSafe, you know, yeah.
Mm-hmm.
They, you know, they got to make a turn, you know, yeah, try to arrange, you know, all the stuff, yeah.
The
working
knowledge isn't
properly.
there.
Yeah.
You're not clearly, you're not demonstrating the knowledge.
Yeah, I will. I will have a meeting every week in the kitchen. Yeah, you can come down, to check it, to give them, to enforce them, to follow the house code, all the rules, the stuff, yeah.
Can I ask a question? How many employees do you have that are in the kitchen?
In the kitchen, including me 5. So it's a 4 actually, yeah, right now, yeah.
4, and then including you would be 5?
Yeah, 5, we got 3, 6,
More than that one, yeah.
so 6,
I think there were 3 or 4 in there.
Okay.
And-
Unless somebody else was serve safe certified,
Yeah.
neither of these two were in the kitchen when we were there, so
Right.
nobody was serve
Right.
safe
Right,
certified
and there always
in
has
the
to be a
kitchen.
person in charge that has the Serve Safe certification, and as well as the anti-choke. That's
Oh,
another.
yeah, okay, that one I
Have
will.
greater than 25 seats?
Yeah.
Total in your establishment?
Yeah. This,
Exactly,
yeah,
so
this another.
That's another, a person in charge
Yeah.
needs to have that certification as well
Okay,
as
yeah. All right.
allergen training,
Okay, yeah.
okay?
So for this one, I really don't know yet, because every year when updating the stuff, I just, give a copy of this one. That's it, so, yeah. I will, yeah.
Well, every year when you renew your
Yeah.
food license, you need to send in
Yeah.
all your current and up-to-date
Yeah.
Serve Safe certification, anti-choke, allergen. We have to have that every year
Okay.
in order to renew your food license.
'Cause, yeah, every year I just send this one, yeah, so. Don't, yeah.
Sorry?
We didn't.
No. Well, we did, but it has since expired. Not that one, yeah.
We did not receive any of this last.
Nothing came in the last time? Okay. So I know when Tom had gone there, he had wanted to hear from your contractor within 2 weeks. I did speak to Tom today, and he did get a phone call from a contractor, but,
This a little misunderstanding. When I just came back, the first one I called is Tom, and then he said, don't talk to me. Right now all the issues move to my boss. Yeah, so I just like Bill. Bill called you today, right? Yeah,
Yes,
Yeah.
yep.
Yeah.
yep, but I guess that,
But he's not the. I contacted with other 2 or 3 companies. Because one is very, very good. That's in Boston. Is doing all the construction for the Chinese restaurant. Yeah.
now, let me just, back in 2012, that we had similar issues, and they were supposed to be taken care of. And this is now 4 years later, and we're still addressing the same issues. Again, the food storage on the floor, of the walk-in cooler and the freezer. They're all similar, if not the same thing. So in 4 years, nothing's changed. And I understand it takes time, but 4 years is a lot of time to try to have things change.
I understand. Yeah.
It's not like we're saying it was 4 days or even, 4 weeks. This was 4 years that this has been an ongoing, that we've been back and forth about this. Let me just see.
So a plan is going to be, is a new plan going to be submitted
Yeah.
to the Board of Health office? Do you have a time frame on that?
That's what I said. Yeah. This at most 2 weeks, because there's another company coming tomorrow. Yeah. You know what's because we live, here from Boston, it's a little not easy for them, a couple company actually reject us, they say, they cannot come so far, yeah. And I try to contact some local, contractors, and I don't know, yeah. I got a headache, for, a lot of contractor, here, yeah. From my experience, yeah.
You mentioned about your cooler and freezer and refrigerators, that they were all working.
Yeah.
And, yep, I never looked to see if there were thermometers in there,
Yeah.
because I'm trying to think of a good word.
We weren't doing an official inspection.
No, and
We
I
were
was
looking at
I
the
was looking at
condition. We
other
were just-
items that
yes, we were-
took prior
Yeah,
that were
Precedent over the other.
much more, important than that. But the issue with the coolers and the freezers and the refrigerators, there's several issues with them. The food isn't properly stored in them. They're overcrowded. Nothing was labeled. Everything should be labeled, dated. None of that was done. So, that's why I never looked for a thermometer.
And then food items always, they need to be protected from the environment and other sources of contamination, which clearly they're not. And it's a repeated pattern. And it's, every time, there's an inspection, it seems to be, one of the violations. And it may be corrected for the time being, but it goes right back to where it was at that time of the inspection.
That's definitely a problem, but
The improper thawing.
we
Improper.
running the food fast and we didn't, get too much. So actually every week it's all gone, from the freezer. This is the truth. I don't lie, but it's not right. We need to, what's a date, according to the stuff. Yeah.
And the improper cool down.
Yeah, improper thawing. What we've all, what we have observed is not the way that you learn how to thaw. You could potentially make somebody ill, and that is a very critical violation. And as far as secondary thermometers go, secondary thermometers should always be placed inside the coolers, whether it is a freezer or a refrigerator or walk-in unit, and it should always be placed in the warmest part of the unit, not by the fans. So that way you have a true reading or true temperature inside. Should something occur, you would know how long the food is out of temperature for. And without that there, it's difficult, and we can go in, we can temp food, but if the door is open and closed, and there's no temperature logs for the refrigerator units, it's hard to to tell you, when something's out of temperature and when you should dispose of it.
That's what
So-
I said.
so it's you need to.
put an excuse, I just said it's true, we didn't, make anything, bad there, but you're right,
And your
all
equipment
the
needs to-
knowledge,
Right, your equipment needs to be in good repair.
Yeah.
I think one of the other things that concerned me was that when we questioned your staff about a couple things, their answers were way off. Such as hand washing and where they wash their hands and things like that. That was way off. And it's just concerning to us because we want to protect, we want you to succeed, we want you to do the right things, we want you to be able to have a good business, that's what our job is, but we have to be protecting and making sure that you're following all the laws that the state have put in place, so that, and that's our job,
Understand.
so it's a difficult situation. Do you have any
Is the
questions?
ServSafe certification done online, or is it done in classroom form with a
By
teacher?
class, those two, yeah.
You do it
Yeah.
in class, and,
Yeah.
is it English-speaking instructors for all the courses, or are you?
Chinese. Yeah.
Chinese?
Yeah,
Okay.
I have to, yeah. But I can rearrange. I instructor come down, to give everyone, including people working outside, the stuff, yeah.
Could I make a
Then the
recommendation
idea,
to the
yeah.
board?
Yes, please.
One of my recommendations would be, even though you have recently taken the ServSafe certification, knowing that the person in charge is not able to demonstrate knowledge as far as ServSafe goes, I would recommend having a consultant come in at the owner's expense to come up with a plan in order to get them up to the standards that they should be at, and also to work with them into perhaps re-educate them on site.
Similar to what we did with the other.
Yes, we
We had-
asked
we
them
made-
to hire someone for,
And we had everyone that works in the kitchen become Serve-Safe certified.
Mhm.
And that would be one of our,
Right.
could be.
But knowing that they just took the ServSafe certification and the inspection was conducted and you, the board had gone in or you had gone in and did an inspection as well, knowing that, again, they're clearly not demonstrating, what they should be doing.
that's-
I would just strongly recommend, having a consultant come in and reports being sent back here to the Board of Health, and working with them, not just short-term, but maybe long-term to achieve the goals that will be set forth by the consultant.
and would the consultant be someone hired by ServSafe or through ServSafe, or?
You could find the consultants on the, perhaps the DPH website. I could provide a list to the board, and perhaps there's a great number of them out there to choose from.
Mhm. Okay.
Okay. What else? Do you, any more questions that you have?
Well, that's certainly the most important one, that's a good course of action.
Right.
To keep them operating. And-
One thing that I would like to do, if it's okay as well, next week, I know it's gonna take a little bit of time if you decide that a consultant, if it's something that you're going to require, to make a site visit there as well, and just see if, from today, if there's been any progress whatsoever, just to, just make sure everybody's moving forward in the right direction. And as far as the plan, being submitted to the Board of Health office, I know that you stated that you're going to be updating your kitchen to
Yeah.
today's standards.
Yeah.
You're gonna
sure.
include,
Yes,
a
I
prep
wanna do
sink.
it. It's not that.
Include a prep sink as well. So once the plan gets here, and if you're stating that it's gonna be, within 2 weeks, it's something that as soon as it is received here, that either myself or Tom will take a look at,
Okay, yeah.
and will help expedite, the plan review.
All right, yeah.
My only word of caution is that we just remain consistent.
Yes, what we do to one, we.
Have to do to all.
Yes, and how long will it take how long in your thought would it take for them to hire a consultant? We would need proof that they're hired a consultant and that they're on site.
That's up to them as if, they have, lists, or they can reach out to some of their
Want
other
me to reach out?
other restaurants, or, we can provide a list, but it's up to them to contact somebody, see when they, hopefully they contact them back, provide them a contract. It'll be a little bit of a process. It's not something that I don't believe is gonna happen, within a few days. But it matters how quickly they would be able to move on it.
You're talking about the instructor for the
It's all in.
Yeah.
It's more than an instructor for ServSafe, it's actually someone that would be working in your kitchen
Yeah.
and assisting you in bringing it up to a standard which would meet the ServSafe standard and training you as well. Yeah.
Right. I,
There's a repeated history here, and there's a repeated history here, and like I said, it appears as though a violation may be corrected at that time, but it's consistent. You go back in, the same violations are there, same critical violations are there. And it's, you know, in order to have corrective action, you know, I believe that, you know, I believe that they would need a reason, they need somebody there to help them and to be able to stick to a plan moving forward. They haven't demonstrated that yet.
Right.
I think that they really need to start moving forward and working. This is serious. This is serious. These are not just violations just to, you know, push aside. These are violations that perhaps could make somebody sick in the long run, and you don't want that.
Jen's humming and hawing over here. She's having a hard time putting her brain around the fact that the writing on the wall is that we close you until you find, until you come up with a plan. And what we're talking about up here right now is hiring a consultant, someone who is ServSafe certified, someone who is kitchen savvy, someone who can train you and your entire staff on food safety, food preparation, and food handling in a way that you have not been doing.
Help with the storage. You know, I understand you have small areas, but there's got to be a better way in the meantime to utilize those small areas. Stacking food upon food upon food that's cooked, and that's not the way to do it. We want you to do it right so that we're protecting everyone. So, yeah.
Is it possible to have that list for them tomorrow? Yes. So we will help you with a list of consultants that you can bring on, and hopefully there's maybe someone that speaks Chinese
Yes.
on that list.
It's
that
all
we-
right. I can translate, you know.
All right,
I've
and then
been
you
training
can,
for a
and then
long
you can
time,
all
yeah.
train and
It's
be
all-
up to speed. You know, we all have enjoyed the restaurant. We all go there. We
Yes.
all think it is the world's best Mai Tai,
Right?
perhaps. And so, you know, we want to work with you. We want you to be in our community and have a thriving business. That's our point. We're just doing our job for,
We love
Safety.
this community too, you know, yeah.
so.
We sponsor all the teams, sports teams, from elementary school to high school, the band to the local
Right,
church. Yeah,
right,
yeah.
and you support the
Yeah, so, you
community.
know,
and-
I really appreciate, you know what, so you can help me out, you know, yeah, especially you arrange, yeah, someone, to give a special training. Yeah.
Like we said the last time that we encountered a situation like this, this is one of the hardest things we have to do, being on the Board of Health. We want businesses to thrive. We want you to do good business. But in good conscience, we have to protect the consumer. We would want you to find a consultant. We would, yep, we would want, you said about 2 weeks to get
At most,
an
at
architect
most, yeah.
plan?
The important part is to just get the consultant.
Definitely.
And get somebody into the kitchen that can help you get it in order so that you can continue working while you have contractors bid and get things moving
Right.
forward for your new kitchen. So,
I think your kitchen needs to be cleaned from top to bottom.
well, that's what a consultant is going to walk in and.
They can
and do.
begin on,
Yes.
that's definitely something you can begin working on, is that you definitely need, and the consultant will help you with the labeling of items and proper technique for storing and.
Proper food handling, proper thawing and heating.
Yes.
Go ahead
So a
until
week?
that time.
For a week? We'll
well-
give them a week?
Well, we give them until they have a consultant and call us to come inspect.
Okay. So
Sooner than later.
what we're looking for is that, from right now on, consensus of the board?
Mm-hmm.
You're in consensus too?
Yes.
Okay. That we will need you to shut down your business, and you cannot reopen until you have hired a consultant to come and educate your employees, and a reinspection will be done. Julie will go out and do a reinspection. We need you to get in touch with a consultant, get them out so that we can get your restaurant, the kitchen, back up to the standard where it needs to be. So,
What are the standards of the consultant, just so that it's not anyone?
I have a list of them
Okay.
that will come in
So-
and help. When there are repeat violations, they will step in and they will help correct those and educate along the way, just to make sure everybody understands clearly what they need to do.
So they need to be chosen from that list? Okay, they
They're-
can't go out and get their own, it would
Right.
be somebody
They're-
from that list?
Yeah.
they're from the Department of Public Health.
There's, the list, there's a lot of companies on the list. There are some that are local that you could contact right away. And what I could do is I could get you that as soon as possible,
Okay.
Yeah.
okay? And perhaps maybe he can make the call, and even if they can come out here right away, as soon as he needs an inspection, I will be right there. I won't hold
If you
him up,
listen to
because
what we're saying, we're going to get you
The objective is
the,
to get them back
Right.
open.
we're going to get you the list of consultants. As soon as you get them in there and get it cleaned up, we'll re-inspect and you're reopened. So that could happen as soon as you can get a consultant in there, and
Right.
Julie's going to get you the list as soon as possible.
So you mean you close tomorrow?
No, you closed now.
Or close now?
Yes, unfortunately. And just for
No,
official,
excuse me. No,
just
no,
one,
no, no, no.
just one moment, please. Just one moment, please. For official, we're gonna take a vote on that, just so that we
Yes.
have it in the record. So
What time is it right now?
it's 7:07. All in favor, well, you wanna make the most, we'll do it that way, or just a vote? Julie,
Vote's
motion
fine.
or a vote?
What time do you stop serving food tonight?
Around 9 or something, yeah. But you know what's I mean,
Leonie's, we made them
All
short.
right, yeah. All right. I mean, I think that you, since the one, you go to this one, right?
So let us, just hold on one moment. I'll give you,
Sushi's already.
hold on one second. Let me just, we're gonna,
I don't.
so just so that we
Well, this-
know, all in favor, that we're all each in favor of voting to, make them shut down at 7:07 PM?
I shut down my restaurant. You know what's I'm
We're just doing this, we have to do this, so just hold on, and then I'll talk to you. Hold on.
Yes, of course you are. We're not going there. You-
Oh, no,
you're-
no.
No, we're just telling you.
Just give us one moment.
That you need to close now.
So,
So
all-
just stop serving food at this point, and then, let your people finish up and.
Clean up and-
Clean up on a regular, you don't have to walk in and say, everybody out. You
No, let
just-
everybody finish
you
eating.
just stop serving food,
You can go to,
run
you
the
can
course
go
of
to
your
a
evening.
restaurant, to see it after I come back, and everything arranged properly. Everything
we
is
believe
good.
you.
Yeah, we try to.
She says she only go one time.
Okay, yeah,
Okay,
yeah,
but
yeah, don't-
I understand, but
Yeah.
We
Hold
set down
on.
the sushi already. We didn't have
I-
any more sushi.
we understand
Yeah,
that
she
they
said
shut down
she said that-
sushi. They don't serve sushi
Oh,
anymore.
we know that.
Yes.
We didn't have any more sushi.
We-
We're
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 not-
aware of that. That's not even begun to being discussed this evening. The things that we were there, we saw many things ourselves, so,
Oh, that's not right.
Need a motion.
yes.
So I make a motion that we order Yummy's closed as of 7:10 this evening until such a time as they hire a consultant.
Okay, I second that.
I have a motion and a second. All in any more discussion about this? We'll continue with you in just a minute, just let us take it.
That's okay. We-
All in favor?
we accept.
Aye.
Aye.
It passes unanimously. So, Julie will get you the list of your consultants. You'll need to get in touch with the consultant as soon as possible, get them out there. Once they come out, give the Board of Health office a call, and we will get Julie back out to do a reinspection. They'll get everything brought up to where it needs to be. And we do need new copies of your Serve Safe certification. And the allergen training, that will have to be brought up to date, and the choke training needs to be brought up to date. Those will have to be as well.
The consultants have all that so that they can continue to operate, but you have to have the consultant until everything's up and running and the consultant says you can, operate on your own.
And this is their information.
And is there gonna be a reinspection fee? Reinspection fee?
Yes, when we go back out to re-inspect, when Julie comes back out to re-inspect, it's $100 reinspection fee for the reopening. That's the standard. And we want you to get back open as soon as you can and get running back up the way it should be. We don't like having to do this. It's not what we want to do by any means, but it's what we've been placed to do.
I really don't understand. We've been 15 years, I don't understand at all, I mean, I really don't understand, that's all I can say,
Well, hopefully
Seriously,
the consultant will help
you
you.
know-
Seriously,
I-
we still have an hour, let me finish those stuff, and I shut down my restaurant myself.
Yeah,
What's that?
I don't care.
You-
Yeah,
you-
yeah, yeah, it's not,
I
it's
close
not for
forever.
that,
I
yeah.
got headaches, I mean, seriously,
Yeah.
that's not right, I don't understand.
I just said,
She's complaining
When
about sushi, we cut off the sushi, and I don't know what to do, what else we need to do, I mean, seriously. No, I mean, listen, I'm seriously, I didn't understand also, why is it the matter? I don't understand what is going on in this world. Oh my God.
I know that she got a lot of pressure,
Jesus,
but you know
I
what,
mean,
that says was
seriously,
for this
Michelle
stuff,
scare me every time I want to shut down my restaurant. Every time he show up, I will shut down your restaurant. Oh, I didn't hear me now. Every
It's
time
true.
they close my restaurant.
Every
I will close
time
my
he
restaurant.
expected.
I can tell you, we
Oh
have
my God,
we
I-
have the records of
I
all his.
request
Can
send
I,
the state inspector to check a
Yeah,
restaurant.
because he said that's
if
illegal.
if we were to had,
Illegal,
if we were to have the state inspector come with us on that Saturday, they would have shut you down immediately.
You should,
You had,
it's a
you
happened
had,
before.
no,
It's a
Jen.
happened
okay,
before.
excuse me. All right, I will give you time to talk, but you need to listen to me. I have been doing inspections on restaurants since I've been on the Board of Health for 8 years now, okay? I'm not, you have made me go here. You have made me say this to you. When I walked into your restaurant, I was appalled, point blank. I was horrified, and I have eaten there for 15 years, okay? Do you think that this is what we wanted to do? We have seen restaurants. We have shut down other restaurants because of this. You have very many critical violations, okay? It's not that we just decided to come in and do this to you. We had to think long and hard about this. We researched every violation that you had. I brought in my covering health inspector to try to help you to understand. This is not done lightly. This is not what we want to do. Okay, we have regulations that the state puts in place. We have to follow those regulations. My health inspector has to follow those regulations. He does. If he doesn't, we're going to come down on him. If we don't do what we're supposed to do, your customers can come back on us. Okay, so that's why, unfortunately, we have those rules set in place that we have to follow.
Yeah, I understand, Jan. But, you cannot just go over to check again, yeah, because that day, I really don't know what's happened, and then, to find out
I can show you
what's
pictures
happened,
of what we saw if you'd like to see them. We do have pictures. Are they in the folder there? You can see the pictures that we saw. We documented.
Because it's so horrible for me too when you said that. I've been, working in the kitchen for 15 years, and then
Yeah, like you
Oh,
say, it's
it's
horrible,
really
it's just really,
yeah.
really
So
not- we feel so bad for that too,
Yeah, by all means, look at the pictures, and we can explain to you in each picture what's wrong. More than happy.
So for this one, yeah, the
You wanna-
the chicken finger,
Which one?
Can you,
oh.
I'm not sure she looked at the pictures.
well, this way she can tell.
This chicken finger is a cover, right? And then
The chicken fingers were
Yeah,
uncovered.
they all covered.
The
It's
gentleman,
just-
as we were walking through, the gentleman that was there was just ripping off saran wrap and lightly putting it on top of the chicken. It was not properly covered, and it wasn't covered before we walked in the door because he was throwing the saran wrap on things as we walked in the door.
So you see right here, this food is not protected from the environment. All the contaminants and everything will end up in this food and in here.
Just
And
in the
probably
freezer, yeah.
in there too. Again,
This probably, hello,
Right,
they got,
again,
have the,
everything needs to
they got
be-
something out, they can put it back. And then,
all right, so, and then, do you want me to go through the pictures, or do you?
yeah, I
you
know,
understand?
all
Okay.
that, yeah,
Okay.
but for this stuff, right? And then I heard that they are making the chicken fingers, right?
Food
So
on the floor.
yeah, they put
But
Yeah.
the,
Was that on the rack?
no, the
Were
food
those
was,
the ones on the sliding rack?
this was the,
On the floor, yeah, oh, those were the ones on the floor.
they can't be on the floor. You can't have the container of food on the floor. It has to be,
I think part of it is it's a different cultural way, because I know, like, when I go to Chinatown and stuff, I see chickens hanging in the windows
Oh,
and
it's a
all
lot,
that
it's a
stuff.
lot.
Like, I think some of it is a little
No,
bit of that, but
Because they making it, they just making it, you know, they take it outside and they're making it.
she's saying that they can't, the bowls can't be on the floor though.
Yeah, I know, but, yeah,
Is
it's-
where, is
yeah.
what's going on.
It's to be on a
Anything-
table.
Anything can fall into those buckets, anything.
right.
So we're done, basically?
Basically, at this point, it's that they're shut down as of, finish the customers that are there, have them eat and leave, but nothing more. And they are shut down. They need to hire a consultant that will come in, hopefully help them to understand and explain more so that they understand the reasoning behind it, that there are many reasons behind it. And then, once the consultant is there and feels you're ready, contact us to do a reinspection.
So, no food serving?
No. Absolutely no food serving.
So the doors are shut, no alcohol, no nothing until this is done? Okay, so just making sure we're clear on the
Right.
drink
The bar can
part
still
of
be
that
open.
as well, so.
What, Ken?
That's up to the board.
But I don't know that the bar can't be open, they just cannot serve any food. Do you?
No, but we shut down.
So tomorrow,
Stay consistent.
They don't have liquor, do they? The other place?
No,
Yeah, you're right.
but I still feel it's,
Mm-hmm.
They have a bar and a keno business and other things that they do other than food.
how do we regulate that they're not going to?
Oh.
Or the kitchen needs to be shut down.
You can.
You're gonna go every night?
I'm not, I
Huh?
would vote against
We
that.
have to go every night to watch.
Yeah.
You don't have to go have a Mai Tai.
Please.
I don't know. Do you?
You could
No.
go.
I don't. You sure?
Yeah,
Do you
Yeah,
agree
there's
with
no
the-
way to watch.
that, I just,
Mhm.
yeah.
All right.
Okay. Go ahead, did you have another question?
No, I was just waiting to see. Do you happen to know how long it takes to go through that course?
It's not a matter of going through the course, it's a matter of
No, I
hiring
know.
a consultant.
He went through the course. Now I'm asking for me.
You cannot be hired as a consultant by just going through the course.
Okay, no, but I was wondering if I could at least get a head start while they're trying to, I do have food experience. I have worked in Quinn State Community College, CAF, I have worked Burger King, McDonald's, I've done several restaurants. But
it's all right, yeah.
I was wondering if maybe I could help in some way, you know, I know that,
It could take more than a week or two to get ServSafe certified by the time you contact them,
All right.
get it scheduled
So
and get
right
it
now,
done.
you know what's
So that could
it's
take,
you
that
to
could take
find-
weeks.
Find it, or is it me to find a
no, she's gonna give you a list.
A
and
list,
then-
right?
You can
and
also,
then
you can
you're
also
going-
check with
then
some
you can
other
choose.
local establishments too,
Yeah.
and they may have somebody
Yeah.
that they have used.
So you don't have any information?
There's a list,
for-
I'll provide you, yep, there's a list, there's quite a few names on there. There are some, people that are local, that could
else had a
come out.
question.
Yeah.
I think Mike, yeah.
The gentleman had a question.
Yeah.
Can we get-
Do they have an email address?
We'll check. Do you have an email address?
Could we have your email?
Eighth? Okay.
Well, could you write it down for us
I'm gonna have you
after?
write it down for me, Dave.
And then that way it can get emailed right over to you.
Did you have a question?
Yes.
If you can just come up and just identify yourself, just so we know. Go ahead, you can go.
My name is Michael Doherty. I grew up in the area. I don't currently live in town, so I was told I couldn't speak unless I had permission. The only question I would have during the time of closing is a requirement to have anything listed on the door as per the closing that should be done so that everything else follows suit.
Yeah, it'll be posted. I know Tom last time posted, so we will get a posting. You have the stuff in the office? Then I can go tomorrow and post, I will post it tomorrow, because I'm in town tomorrow.
Okay. That way I just wanted to make sure that they understand that it all coincides and goes together so that there's nothing that can go back on anything, everything's followed
Nope.
through and goes forward.
Yeah, we post,
Post.
yeah, we do.
Okay,
Yep.
thank you.
No, no problem, thank you. Any other questions? Thank you,
Right, thank you.
and we look forward to hearing from you soon.
All right, guys, let's go.
Have a good evening.
Thank you. You too.
Yeah.
Okay.
That's, I think the yellow was for them.
Tammy.
The yellow is for them? Oh,
David?
this whole packet.
It just lists everything.
What is that? What else is it? Expired items.
Yeah, so I'll go and get copies of all those, because they said they were actually hanging up in those restaurants, so. Oh, okay, I wasn't sure if that was your copy or not.
You know what,
Okay.
why don't, you
So I
wanna
can-
move on? Place up the entire decision,
What?
the packet, and I can bring it all by to them.
Get it. We'll just bring the additional.
Which way do you want to go?
Doesn't matter, I just,
Oh, who you- I didn't.
I think it would be, having the packet all complete.
Yeah, we'll bring it.
Okay,
We'll
all right.
Make a.
You want the
packet
pictures too?
tomorrow.
She said we could
Yeah,
have them.
that's fine.
All right, so, yeah, actually, just give that to them.
Now, just out of curiosity, because, I see
I took the pictures for your
totes.
question.
So if we did, like, new totes that have the actual plastic covers, like, there are those
want each name
more
individual or
looked
just
at
Mr. and
upon
Mrs.?
than some plastic wrap over the covers?
Well, something that you can label, like this one here
Well,
is
yeah,
a
like
package,
that
so
you could-
you
you
can't
could-
date that, this, certainly,
And-
there are all kinds of equipment, restaurant equipment
Yeah.
to accommodate these
Yeah,
situations.
and like, I know they
And
do
it's
make
just- there's so many
covers to go
varieties,
on the.
yeah.
Like-
And,
like
and
things
also,
like-
if you're putting it in a black tote, you can't mark the date on this with a dry erase or anything.
No.
But you could
On the white ones, yes,
And
that
these come with
and those,
Is that all you want?
those
Is
are the
that-
ones I'm looking at. Like, I know those are
Things like
storage,
this
they
can't
come
happen.
with
You're
covers,
welcome.
they,
See
you
this?
know.
Well,
Yeah.
we've known him way before they did the restaurant. We just wanted to come. Like, I grew up in Webster.
Yeah, because the other one's not even covered.
I had 28 years in the postal service. I just wanted to come here for support, but I was told that if we came,
It's no, she's gonna.
Yeah, Teresa's gonna.
Sorry, I
I said,
Okay.
it's a little bit of a barrier
All right,
issue
well, thank you,
sometimes in
guys.
language.
Thank you.
No, it wasn't easy, so. All right.
Thank you.
Thank you.
You're welcome.
Sometimes what happens is the tofu containers, they, some staff just try to use the tofu containers that look like. So you just have to get it has to be an approved container.
Okay, now, up next is Health Inspector's Report. I'm not looking for anything from you, don't worry, this is just normally on. So
You
we're,
don't got anything?
we're good with that. We're just gonna move on and continue on to old business. We had the rabies clinic on this past Saturday, and there was a small turnout to it. We had the flu clinic this past Tuesday. which I believe went very well from what I heard from Deb Visera. Under old business, I'm gonna bring up a couple things. Sarah contacted me regarding the trailer. If you recall, we discussed the trailer and who owns the trailer, who, the origin, da-da-da-da. Okay, so the town actually owns, not owns it, I should say. It's property of the Department of Public Health. The town, back in 2009, she found old minutes, Sarah did, stated that we were to take the trailer, we were going to insure it and register it. The Board of Health at that time agreed to do that. It doesn't cost to register because we get the Mass Blue plates. And the insurance, we're a self-insured, so it doesn't really cost to insure it. So what she's doing is checking for a certificate of origin to get to us so that we can actually do those things to the trailer so that it is legal. The certificate of origin, the maker of it is in South Carolina, and as you know, they've had some very bad weather, so she hasn't been able to get through to them. She is still working on it. So as soon as they get that information, she will get it to us. She also mentioned that she sent an email. Teresa, did you receive an email from her about training? If you can send that out to all of us, because that's something that we have to do. I thought I did. If you can resend it, just where this is online training that we have to do, because you know how we have, what is it, measurables we have to meet each quarter through the EMS. This is one of the things we have to do some training. Then also Deb Visera was here for the flu clinic, and she also mentioned that, as Sarah mentioned to me also, that the monthly meetings that are held by Region 2 meetings in Worcester, we have to have a voting authority there. Tom doesn't attend those meetings anymore, so we have no one there that is able to vote for us. We have to appoint someone the ability to vote for us. The person who does the voting for us is, Sarah will tell them, like, Sarah can't vote for us because she's our representative. But she's the one who explains, like, this and that, and this is something that you want to vote for, or this is something that doesn't. So.
And who does she consult on that? Who was the person that she's consulting to vote on our behalf?
Well, Deb Visera has contacted me that she can vote on our behalf.
And who is she?
She is the Harrington Hospital community health nurse. There, yeah. Jim Philbrook, who is the health agent in Charlton, also mentioned to me that he could vote on our behalf if we would like. The meeting is held the first Thursday of the month, I think like 9 to 11 or 9 to 12, and it varies from different locations. So, short of one of us always attending that, we have to assign somebody to vote for us.
So we choose to assign somebody to vote for us?
Because we clearly can't
Yes,
make
and
it.
I
who would we
I
like
can't
to
make it
assign?
at that time.
Would we like to assign Deb Visera to? You can go, is that what you
No, I
just
said I can't.
Oh.
I would love to, but
I
the
would too, but I
time.
can't ask, to leave the first Thursday of every month.
No,
It's,
too much on my plate for that.
yeah, it's just, and I think it's better if we, so, I don't know, we just have to make a decision, and then there's a letter we have to send in.
Correct.
Do you attend those meetings?
No, I don't. I don't. We have,
You have different, right?
We have a designated, person that attends, who's wonderful. But, I could send you a copy of the letter that you'll need to write.
So it's basically up to
So Deb Visera or
Or-
the,
Jim Philbrook.
and Jim votes for Charlton?
Yes, he does.
And Deb votes for,
Many other towns, if I am understanding correctly.
And if she votes for something that we don't agree on,
What do we
would it-
do?
yeah, If she votes for many other towns, that, how much of a block does she have of that decision?
What if we don't like what she says, or
She
votes on,
would be
you
voting
know?
the same way for every town or
And
community.
it's for what's in the best interest of, so,
Right.
you know, it's not, whichever person you choose. It's a good decision, whichever one you choose.
Sure, okay, all right.
And will we know ahead of time what they're actually going to be voting on?
Not necessarily.
And then, oh, okay, so,
We need to know.
like, well,
Not
It's in the best
necessarily.
interest of-
Of the
it's in the
community.
best
It's in
No.
the
interest
best
of
interest of the
so-
community.
but for
Yeah,
somebody, I don't know, like, all right, it's kind of weird.
Sarah will probably inform you as to what's transpiring, so.
Yeah.
All right, so who do we want to make a motion to assign,
We need to
to
definitely
give
vote
our
on it.
voting?
Talk more about it, or?
Is
we
it
have
a
to
vote or
decide
is
now?
it a discussion?
decide
or-
now?
We have to decide because
Okay.
I need some credentials.
this
I need
is,
to know who these
well,
people are.
okay.
The community health nurse from Harrington Hospital seems to have the proper credentials to
Yeah,
vote on our
that's
behalf.
true.
And what is,
I like
Jim,
that.
The
Jim
community.
Philbrook?
He's also, he works for the Board of Health office as well. He does all their inspections. He's a very intelligent man, too.
I'm gonna go with the nurse.
Do you know both of these
I'm
people?
gonna stick with my people.
Have
I know who they both are.
do you have a recommendation over one
No, I
versus
do
the other?
not.
It just doesn't really,
I do not, that's the board's decision.
She's tough.
she is
I'm
tough.
going with the nurse.
You go with the nurse? All right,
Sticking with my
so
kind.
make the motion. Make your first motion.
Are you sure?
Yes, make
Yeah,
it.
make a
You can do
motion.
it.
No, I know I can, but like, I don't know her.
No,
I
that's,
just
that's
don't
fine,
really
I
feel
don't need to know
comfortable.
her. If she's the
What is she
community
voting
health
on?
nurse for Harrington
Bad
Hospital, I have
idea.
confidence.
And then we say, oh, we didn't like that idea. She voted for us. Then what do we do?
Well, it's a majority vote, so I think that it's not,
I don't wanna say stuck either way, but we're in a predicament where we have to assign it to someone else,
So
so.
what are these topics? It's not stuff like that we're talking about here.
Oh, no, it's, oh gosh, do they decide like how to use money?
For like flu clinics and the rabies clinics and stuff like that? You're smiling. Share.
It's,
she's not putting her 2 cents in,
All
that's
right,
what
well,
she's.
okay, fine.
so,
My chiefs are there, you know what I mean, I'm not putting my 2 cents in.
Yeah.
They're, it's up to you.
I make a motion that,
Let's vote
what is
for
this
her.
what is this meeting of? It's a meeting of who, what group?
Department, Region 2.
Region 2,
Region 2.
Emergency preparedness.
emergency preparedness.
Some great
I make a motion that Deb Vicera
like that
from
group.
the,
Harrington Hospital Community Health Nurse.
yes, am I making the motion or you?
No, I'm helping you,
You
because
can.
I wrote it down.
I make a motion that Deb Vicera vote on our behalf at the Region 2 Emergency Preparedness Monthly Meeting.
Okay, I second that.
I have a motion and a second. Any more discussion? All in favor?
Aye.
Aye.
Nay. 2-1. It passes 2-1. Don't look at me.
I'm like,
What
who
was that? Did
said
you
all
have more
that?
discussion before? we
No,
did-
no, I just have a personal preference. That's, I have that
Did you
right.
have a personal preference other than, okay, all right,
That's all.
all right.
I just,
We could have discussed your preference.
no,
And
it's,
if we
I,
all said no, if I said no too, we're stuck.
that's okay. It's
Oh.
okay.
All
I,
right.
I like both of them. I have,
Exactly.
I just had
They're
one
both
more than the
great.
other, so
Okay.
that's all. No
All
big
right.
deal.
Okay,
That's all
moving
right.
on.
You could have said that.
That's
It would have been
all right.
fine.
Right, 'cause you said nay very loud and you made me flustered. We're on TV,
I'm
aren't
so
we?
sorry. Yes, we are, but it's okay.
I'm going to invite my father to the next meeting of the Board of Health so
Everyone's
that he could
watching.
put in his 2 cents.
I invite my father too.
Anything else under old business? Anybody else have any old business? No? Okay, so new business. I have some new business.
Oh, I thought that was new, old.
Yes,
I
sorry.
thought that was new.
It's okay.
Okay.
It can be
No,
written anywhere.
I
It's
know,
your
I know,
notes.
I know.
Monday, this coming Monday, October 24th, is the town meeting. It'll be 6:30 PM at Shepherd Hill Regional High School.
What date?
Monday, the 24th, 6:30.
It's the town meeting.
Yes, there are many warrant items. We don't, the Board of Health does not personally have anything, any warrant items on it, but it is always good to be there and support the community and have a say in what goes on. There are some big items on there. One of the big things is the fire station will be on. And then just other typical, like, I don't know.
Is the fire station on the ballot for the next election?
The fire station is on the ballot for the next election, but it has to pass at town meeting with a 2/3 vote in order for it to be valid on the ballot.
What other big items are on there? Mrs. Canoyer?
I'm looking at it in my head. There was, I think, a couple things that got passed over. There were a couple trucks. There's some, I have the paper back in my office. Some things that had to be paid, some, I don't know if there's road updates. Yeah.
So it's a good meeting.
It is, it's a good meeting to attend. The selectmen's meeting will be at 6 that night, then it will flow right into the town meeting at 6:30 up at Shepherd Hill. I think it's 6:30.
6 selectmen, 6:30. That's a quick selectmen meeting.
Yeah, it's just to finalize information for that meeting. So the town meeting will be that night. So if you have nothing to do, come on down, hang out with us up at Shepherd Hill. It's always a fun time. And also, just to let you know, our next meeting goes back to Tuesdays, Tuesday, November 15th at 6:30, and we'll be back in the small room. So you do want to just, Teresa, remind Brian that he's back on. And we'll be saying goodbye to Fred, probably just for a short while. So,
Short while.
anybody else have any new business? Anybody have anything else they'd like to say?
No, but I'll make a motion to adjourn this meeting at 7:37.
And I second that.
I have a motion and a second. All in favor?
Aye.
Aye. Meeting adjourned at 7:37 PM.
Adjourned.